Good evening, everybody. Hope you're well. Welcome to this Instagram Live. We're super lucky today to be chatting with Dr. Juhee. Some of you guys may know her from her Insta post. She's quite a fascinating GP trainee. I've never met Juhee, but I've seen her post, and she seems to be doing a lot of amazing things coming up. So I think Juhee has just joined. Let's see if we can invite her in. Hi, Juhee. How are you doing?
Hi, I'm good. How are you?
Good to see you. Sounds like a long day.
Yeah, it's been a long day, but
Is that GP trainee stuff? Is that what you've been up to?
no, I guess I was just sort of popping by to RSM's Aurora Society of Medicine.
Okay.
For a quick meeting, but no, yeah, GP I finished on time today at 5 o'clock, so
That's
good.
very good. That's very unusual for GP land. So well done.
I know.
So you mentioned RSM already. I've not met you, Juhee, and I've just been seeing your stuff on social media. It seems like you do loads of different things, and that's why I thought it'd be really, really useful to get you on board, because a lot of questions come my way about different careers, and I know you've had thoughts about surgery, you're doing stuff with RSM.
Yeah.
So it's really good to get a bit of a snapshot into your career, the decisions you took, how you took them, and how you're feeling about GP training right now. So for those of you, especially thank you for coming on. For those of you who don't know Juhee, can you give us a really quick snapshot of where you are in training, what your journey's been, and I'm sure we'll pick up some of those things as we go along.
Sure. So I'm a GP ST1, which means I'm in my first year of general practice training, but I have been a qualified doctor since 2017. So undergrad, I went to St George's in South London. I did a BSc in cardiology actually at Imperial, but I've obviously not pursued that.
Yeah.
And then I did F1, F2 in South Thames, and I was interested in surgery sort of mostly post-grad. And I also enjoy general practice. I kind of ruled out medicine early on just because the med-reg life was not for me.
Yeah, fair enough.
And then I enjoy meeting a lot of people, and medicine, the reason why I did medicine was because you get to meet different people, help a lot of people, and general practice fulfills that in a huge way. And then surgery, because I just enjoy the variety of general surgery, in particular practical skills, and you also get to meet a lot of people and make a huge difference in their life. But I think for me, general practice was far more appealing because of the portfolio career aspect of it, which I'm sure we'll cover, and I can still obviously pursue some minor operations if I really want to. So that's where I am at the moment.
Cool. So you're trying to marry two things together, really, the surgical side and the GP side. And absolutely, the portfolio GP career is what is the buzz right now, and people are doing lots of different things, and it sounds like you're already thinking about how you're going to plan your GP career going forward, and we'll come on to that in a little bit of time. But were you a born medic, number one, and then do you think you're a born GP, number two? Because you've done GP rotation. Was this your first GP rotation that you've done, or did you do some before?
No, so I did F2 general practice, which was really lovely. I enjoyed it actually quite a lot, and it probably really ignited that general practice fire in me then. I think, medicine I was going to do, I think, regardless. I know there's a lot of things that a lot of Asian people do medicine because it's, in their families. I don't have any medics in my family. My parents have always been very encouraging of whatever I want to do. I was actually between journalism and medicine. I knew I wanted to do a vocational career, but I think medicine sort of gives you so much variety, and that's what I love. So I'd say I'm a born medic.
So you went into it for the right reasons then, not the wrong reasons, which is always a good start, because as you know, you've probably seen lots of people who are not really enjoying what they're doing on a day-to-day basis.
And I think also doing medicine for the right reason, it's really useful in terms of you're less like, I'm not saying that you're completely prone, protected from burnout, but you're more likely to burn out quicker just because it's not your passion. But I think more and more we're kind of moving hopefully away from that, and people are doing it for the right reasons, that because they actually want to.
Which makes a huge difference. And born GP, do you think?
I think so. I would say yes, because I think general practice here in the UK and probably abroad, I think, is just fantastic. I think you use so many different skills, which I don't think we necessarily see in different specialties. I think you fall into a little bit of pattern recognition, which I think is important in medicine. Obviously, that's a huge part of how we do diagnosis.
Yeah.
But I think in general practice, you still have to have quite an open mind and be on top of your knowledge, which again I love. I love lifelong learning. I know a lot of people dislike it, but for
Yeah.
me, it's fantastic. So yeah, I think I would say I was
Born GP. Great, great. And so, okay, so the surgical side then was developing early on. And when did you make, so you mentioned your F2 job in GP kind of gave you that final push of this is what I'm going to do. But had you not done that GP rotation, do you think you might have ended up in surgical training by now? Or was GP already there kind of in your mind before?
So I think
And just before, what was it about that F2 rotation that made you think, okay, this is it?
so. I think in terms of surgery, I did actually my pre-med school work experience in anesthetics, but I actually really enjoyed the surgical side when I was
Okay.
working there. But then during med school, I don't think I felt as invited to theatres, and I wasn't, I don't think I got the most out of my surgical placements. And I think that does happen a lot to medical students. And I think, that's why I always say that, you might have your mind set on something during med school, but when you start working, you'll realize that actually you might find something else more enjoyable when you're actually doing the work and part of the team. But yeah, so during my F2, I did surgery, A&E, and GP, and I wanted those rotations because I wanted to have experience in all of them to help make my decisions. I already knew that I hadn't made my mind up, so
Yeah.
F2 will be helpful for that. So
Okay.
I absolutely loved surgery in F2. I did all my surgical courses, so basic surgical skills, ATLS, and then yeah, I did GP over Christmas, and just a lovely practice, really encouraging, really enjoyed the variety of cases. But I was still unsure because I still enjoyed surgery. So I took an F3 and I did
Okay.
the surgical clinical teaching fellow job. So it was still surgical based, but mainly medical education, which is another one of my interests. And then during that year, I was like, okay, this is the year I'll decide basically what I'm actually going to do. But I did actually apply for GP and my F2 as a deferred entry.
Okay.
So I had that already there, and then my F3 I was going to be like, okay, do I need to now prep for core surgical training applications?
Yeah. Wow. Okay. So now you're in GPST1, and which rotation you've done so far? You've done, what have you done so far in ST1?
So the reason also why I went for, GP and I didn't reapply, for example, was because I have quite a lot of surgical rotations in my GP training.
Okay.
Yeah, so I just have done 3 months of ENT and 3 months of urology, which is exactly what I wanted.
Very good.
Yeah.
Very good. So you're on so you're doing 3 months of that. So are you on a 3 month rotation?
So this is actually, it's a mixed, not all are rotations. I'm in the Imperial VTS in London. They're all actually mixed. Not all of them are 6 months, not all of them are 3 months. So some of them are 3 months. So these two rotations, my ST1 are 3 months, but then I'm on 6 months for my ST2.
Okay, fine. Okay. And how's your GP rotation so far? The GP job that you're doing, is it different to the F2 one? Because obviously every GP is completely different, and people get a single bad experience and it puts them off, or they have a single good experience and they think, wow, and then they further down and I think, well, that was just a one-off. How's it so far?
Yeah, it's honestly been fantastic. I think that's why I always say with general practice, you do it because you love it. It's not because of the team, which I think sometimes in hospital specialties, you're more inclined to apply for it because, oh, you had a good experience with the team. But I think with general practice, you will most definitely find a place that, fits around you and works for you and you fall into. It's just sometimes a bit of hit and miss. When you do have bad experiences. But yeah, so this GPST1 GP rotation is completely different to my F2, mainly because I'm in very different areas. So I'm in kind of northwest London, city area, whereas in my F2 I was in Kent. So I was in a slightly quieter area, different population group, and different systems, even IT systems and different ways of processing. But I've learned so much already here, and I've got a fantastic GP supervisor who does a million things, which is actually quite nice because it's kind of similar to how I am, and I think I might be, although I do feel I should cut down a little bit at some point. But I've picked up so much from her and the practice in itself.
That's really good. And supervisors have such a huge influence on the kind of GP you become, isn't it? And someone who's doing 1,000 things just lets you realize that actually you can do 1,000 things and be a GP. And sometimes it being a consultant may not give you that scope, that choice of doing one day this, one day that, which it sounds like your career is going to end up being, given the amount of things that you do. So let's just skip ahead to that, but we'll come back to where you are now. But how do you think your career is going to be? I know you've got a bit of time until you come out of GP training, but you're obviously going to be doing GP stuff. But what else do you think you'll be doing? Is it linked to what you've done already?
So yeah, I mean, I have been looking into the options you have as a portfolio career. I know that I won't be doing full-time GP, and I know a lot of GPs actually, once qualified, there's a very small percentage that actually do full-time GP. But I have a few ideas. I will still hold my hands up and say I'm not entirely sure where exactly I see myself in, for example, 5 to 10 years. Yeah. Mainly because I have also been a little bit of a person who goes with the flow, has a loose plan, and then opportunities when they come, I usually take them and go from there. But I think minor ops will be something that I will at least try to pursue. So you do have a course on offer that you can do, which is part of our 14 Fish I Eat portfolio, and then work from there. I think hopefully my ST3 practice will do minor operations, COVID permitting, and hopefully get some experience there. And medical education is something that I am also interested in. And I've been very lucky with this GP post. I get 2 days working at a university doing med ed stuff. So that's already opening my eyes to what kind of things future GPs, qualified GPs do in a university.
That's really good. So you're doing med ed already as part of GP training, because a lot of GP training say, I want to do some med ed, but actually when they go out and do it, they realize actually it's harder than they think, and it's not really for me. But if you're doing it right now and you're finding it useful and you've grabbed the opportunity, that's amazing. To get the opportunity to do 2 days whilst in GP training is brilliant. And med ed, for me is my passion anyway, so I could talk about med ed all day. But that's really good. So you're already carving out your niche. But what I liked is you said that, look, if opportunities come, I'll grab them, but it doesn't necessarily mean that I'm deciding what I'm going to do when I take the opportunity. It's just that flexibility, having a general idea where I'm going, but having that flexibility to jump on things when they come and change plans if they don't work out, which is really important, I think.
Definitely. I think in medicine, because the opportunities are endless, really. Even if you go down a specialty, I know it's less likely that you have as many options as a GP, but you still can go out of your specialty, do research, work on different projects, do management. There's stuff outside of clinical experience as well. And often I think it can be quite overwhelming because you're not really exposed to that at medical school, and even sort of earlier postgrad level. They're just so focused on getting you passed every year. So I think having a little bit of flexibility and being open to, learning about new things within medicine and outside of medicine is really useful.
Yeah, we just had a comment about your dancing, and we see a lot of your videos on Insta, which is great. So maybe you'll be doing some of that going forward as well, and balancing your career. And that's the beauty of general practice, right? I mean, it's just, you don't have to, as you say, do other things that are non-medicine. But I think with the portfolio vibe at the moment, everyone is talking about portfolio general practice. Do you think, from your colleagues who are doing GP training at the moment, that there's a kind of almost a pressure to not just do GP 5 days a week, or is seen as unusual now to do GP 5 days a week? Is that kind of the vibe that you're getting, that people are kind of thinking, well, I have to find something else? Whereas in the past, it used to be, well, if I can do it if I get the option. Whereas now, kind of everybody wants to do something else, even if they actually want to or not.
Do you know what? That's actually true. And I was thinking about this recently. I think because I often think also that people have to justify themselves for choosing to do GP and doing it full time, which I don't think should be the case. It's a fantastic career choice, and we shouldn't be like, oh, I only did it because it's, I mean, yes, it's a good reason, but it shouldn't be the only reason that you're doing GP. You should fundamentally like sitting in clinic and talking to different patients. But yeah, I feel like it may go down that route, but equally I am seeing that even working in 2 or 3 different practices, even if you are doing sort of full-time GP and not doing anything else, and actually working in different practices is more common. And I think that still quite offers a little bit of variety, because you can work in different areas, you can do different things within the practice, and you're working with different population groups. But yeah, you know what, I have been thinking that, and I think we may be going down the route where there's a little bit of peer pressure that, oh, why are you doing full-time GP? Do you not have any other interests? And it's like, well, I actually like just GP for what it is.
Or you're not interesting enough, or was nobody asked you to do anything else. And I used to be a PD before, and all the trainees used to come to me and say, look, I'm coming to the end now, I'm ST3, I'm finishing in a few months. What am I going to do? Like, I've only got my GP job. And I'm like, well, it's fine. Like, you don't need to do 100 things at the beginning. If you find something, go for it. But doing GP is what you've spent 10 years training up to be, so it's fine to do that for a little while or not, and the option is there. But I certainly noticed that there's a lot of, not pressure I'd say, but it's kind of seen now as more of the norm to be a portfolio GP, whereas 5 or 6 years ago it was the norm to just be a GP and maybe do a few other things on the side. Whereas now you get people do 1 clinical session, 2 clinical sessions in general practice, and the rest of the week is completely different, whether within medicine or not. But yeah, I think it's about getting that balance that works for you, isn't it? And being confident that this is why I've chosen it, and it's for the right reasons, rather than, well, everyone is doing 100 things, so maybe I should do 100 things as well. And then probably being at risk of burning out more because you're not enjoying what you do.
That's so true, because I think that's what people say, don't they? That, oh, the reason why I'm not doing full-time GP is because I'm going to burn out. And then you're forcing yourself to adhere to another set of standards where you have to try different things. And I think going at your own pace is probably the most important thing, like you said.
And not always doing it in GP training. Like, it's sometimes just fine to get through GP training, as tough as it is, portfolios and exams and whatever, and without trying to cram 100 other things in as well. Sometimes you can just get to the end and then develop a career. But it looks like you're starting to look at what you want to do in the future and work at it now, which is great. So you're thinking minor surge, you're thinking med ed, and you're already getting into those things, which is great. How easy is it to balance doing other things and still being a full-time GP trainee, almost full-time GP trainee, which is tough in itself? How do you do it? How do you balance it all?
I think it is definitely tougher than I maybe portray it, but also than maybe people think. I think if I didn't have this integrated post, I'm not sure how much medical education experience I would be pushing myself to get, because actually there is a part of me, like you said, maybe I should just wait until I qualify before I, spread myself too thinly. Because it's just happened to work out and I managed to get the job that I wanted. It's kind of been, touch wood, been a little bit lucky in that aspect. But even with the minor ops, I'm trying to think, when do I do this course? I've got my exam to pass, which is my priority. But also, I want to develop as a GP. I want to become better at my consultations, taking good focus histories, and actually being good at the job that I'm training fundamentally for. So I think that what I try and do is, what I'm trying to do now is sort of plan my next 2 years very loosely again, and see which, when will I be a little bit more free to focus on something. What I don't want to do is do too many things at one go and then risk, not getting, the, achievements that I want from them.
And I've seen that. Obviously, we come across trainees day in, day out, and there are trainees who will go and do 150 things whilst being an ST1, ST2 and do really well at them, and then not get through their exams. And it's so heartbreaking because they realize that, well, actually my base, my core is to get MRCGP and be a GP, which is going to give me the opportunities that I want to do in the future. And it's that balance, isn't it, about making sure you get your core stuff right, just getting through these hurdles, and then planning the next 30 or 40 years and taking it to where you want to go.
Mm.
But it sounds like because you've got that integrated post, you've got a really good opportunity to do this, which is great. And the minor surgery stuff, so are you thinking about courses now and doing stuff now, or is that, do you think, more later down the line?
Yeah, I think it's also quite a unique situation with COVID because minor surgery is quite practical, and I would ideally want to do something face to face rather than just an online course. I mean, it's great just to, top up. There is a course on, 14 fish. I've no idea any. I'm going to look into that at some point. Maybe that for now, and then mainly probably just do a little bit of research before I just, pick the first course that I go for. Because also, yes, I need to, update my skills, but I also need to practice them. If I'm not getting the opportunity to practice during training, which is most likely, not all GP practices have minor ops. Also, in your hospital jobs, you might not have that flexibility. Then, I have to sort of time that a little bit well. But I'm definitely going to be looking things up and I think good research is really important, mainly because, as I said before, we're not really handed this information, are we? It's mainly dependent on us being proactive and talking to the right people who will help you, support you, and just, sitting down and doing your own research.
Yeah, and asking questions, right? I mean, there's so many people that kind of think, well, I'll ask questions when I finish, and I'll look into it when I finish, and I'll research it all when I finish. But then when you finish, you say, well, now I've got to get a job. I've got to start working. And then suddenly you realize 30 years has gone down and you haven't done anything apart from clinical work, which is fine if you want to do that. But if you had these dreams and plans, then the balance is, do I keep putting it off? And if I keep putting it off, then will I ever get to it? Or do I do it now and then worry about, can I juggle it all at the beginning? And it's really hard to make that call. And a lot of trainees have these dreams, but they don't quite know, is it the right time to start it now whilst being a GP trainee, or should I wait? But I've seen GPs in their 40s and 50s who are still waiting, waiting for that opportune moment, which is never going to come because you're on that rat race and you're just rolling around that hamster wheel, aren't you, trying to go from one barrier to another. So, but it's really good that you're thinking ahead. So what is coming up? Like you mentioned AKT, I guess, is that coming up in October? Is that, are you doing it at the beginning of ST2?
Yeah, so that's, again, I was planning to aim maybe for October, but also I want to think about what placement I'm going to be on. So I'm doing a neuro/stroke placement for 6 months, and then I've got public health. And I think maybe public health might actually be a slightly better post to get it done, even though it's later in my ST2. But then, I need to have confidence in my revision. And I think that's going to be a decision to make. But definitely, I think it will be either the next sitting or the one after that, most likely.
So if you're doing 6-month rotations, then actually, if you're looking at public health, you're looking at the May sitting, really, aren't you? Because both the October and Jan sitting, you're going to be in the first rotation.
Yeah. I guess it's quite difficult, isn't it, without getting our rotas, which we never do time.
Absolutely.
But I think this is why I was thinking, if I can see, how my base is now in this general practice rotation, I'm feeling quite confident with, the guidelines and the different aspects of the AKT. So I have already got my, past med, whatever. I'm starting to look at what webinars and what resources to use, and then just need to sort of set a date and then start my revision from there. I think often starting is the most difficult point, and I think me personally, I've found that.
But starting is hard if you haven't got the plan as well, right? Because some people say, well, I'll just start and kind of see how it goes, but your brain is never going to jump into it when you're not really sure, okay, I've got a deadline, like I'm doing it in October. So I mean, and therefore kind of planning that out and thinking, okay, this is my date and I'm going to do it now, that is going to push you more into gear, isn't it? And I guess which is human nature, isn't it? When you have a target, you get pushed.
So I think before, like, I had already made my mind up, I think by May, that I will know which date I'm going to pick. I definitely agree with that. I think without having that little bit of pressure, it's a good kind of pressure, as you said. You need that motivation and drive, otherwise you're never going to push yourself to learn the material and practice the material.
It's like anything, isn't it? It's like, even if you wanted to develop a career in something else, and that's why I think people end up just kind of thinking, one day I'll do something, or one day I'll become a gypsy in something, or one day I'll try something new. Unless you kind of set yourself that target and say, well, it's going to be done by now, you just you're going to get comfortable, aren't you, in what you're doing on a day-to-day basis. And
Yeah.
that's why a lot of GPs get trapped, I think, to that, Monday to Friday, one day I'll do something else when the
Yeah,
time's right.
for sure. And I think that's why even, the things that I'm doing now, recently, getting involved with my local vaccination center in community projects, that again, I have to say I've just stumbled upon, just
Yeah,
happened to
yeah,
meet the
yeah.
right people. My GP supervisor is the lead and does a lot of work.
Okay.
She's kind of she's PCN director, and she also, signs off on a lot of things, so she knows what's going on in the area, and she would suggest it to me, and I'd be like, yes, why not? I'll give it a shot. And then, doing it once, putting yourself out there. And then now it's just become part of my training. And
Yeah,
I'm learning different skills that I think not a lot of trainees might get exposed to.
yeah,
But I think
yeah,
it's quite useful. That's why I do like sharing it, showing that people actually, there is a lot of variety, not only within, the clinical consultations and what we see on a day-to-day basis, but also the kind of things you can do as a doctor and as a
yeah,
GP in the community. Because at the end of the day, I think, for me personally, I can say one of the reasons I wanted to be a doctor and do medicine was to have an impact on my community, wherever I may be staying, or the wider community, or where my parents are from, whatever. And actually, it sounds a bit cliche, help people, but for me, that is the bigger picture out there.
yeah, yeah,
And actually using my job and career a little bit more than just my day-to-day clinical, one-to-one person that you're seeing and benefiting them, and actually getting involved in these projects is a bit more satisfying, I think.
yeah,
And
yeah, yeah.
I could easily just say no now and be like, I've only got, my GP training to focus on. But actually, this is working towards me when I qualify, be like, actually, I've got experience in this now. Maybe I can go and suggest more projects and actually lead them, or get
Yeah.
involved with other projects because I feel comfortable enough doing that.
Yeah, that's really good. And two things stand out again there. Number one, the opportunities are going to come, and it's up to you to say yes, because it's
Exactly.
so easy to say no. And
Yeah.
secondly, when you take these opportunities, you don't know which connections you're making. You don't know which people are
Yeah.
starting to know about you and you know about them. And who knows when that's going to come to fruit later on when when you need something, or when you want to take an opportunity in future. Whereas if you said no to everything because of the fear of, well, okay, I'm just
Mm.
going to buckle down for 3 years and just focus on myself,
Mm-hmm.
then maybe you miss out on those, things
Yeah,
in the future, and then you struggle to get into something new later on.
exactly. And I think also it's really important to know yourself well. Know what your limitations, your weaknesses are, because no one's perfect, and
Yeah,
knowing what you can balance, as you said, you know, can you take on what you're signing up to? But I think trying something out is always a good idea. And if it's not for you, at least you know that you've given it a shot. You've got that experience. You can even add it to your portfolio, do your
yeah,
reflection on it, and
yeah,
also know, actually, this is not something that I'm going to pursue once I
yeah,
qualify.
yeah, yeah, absolutely. But unless you say yes, you never know those things, do you? You just kind of think, well, one day I'll find out. But
Yeah.
I've got to ask you about the dancing,
Yeah.
because that's what you're kind of getting famous for,
Yeah.
especially on IG. How's that? Is that started from the beginning? Is that something you've been doing for many years? And how does that help you currently as a GP trainee?
So I have always danced. I think I'm also a born dancer as much as a born medic and born GP. My mum was amazing and put me into ballet school for at least 10 years of my life. I was actually born in Scotland, so
Okay.
very different to obviously now where I'm living.
Yeah.
And I had the opportunity to develop my dancing skills. And again, I think my personality has always been to try different things. And then I kind of started trying different dance forms, learning and picking things up by myself. And yeah, and then I just started performing. I've always been a person into performing arts, and I've always kept that alongside my education. And
Okay.
I've always found that having something that's completely different, whatever that may be, and I think a lot of medics generally are like that, drives them to actually do better in their job, and also just focus on what makes them happy. So
Yeah.
my career gives me happiness, and also my dancing does. They both do. I don't have to pick and choose.
Yeah.
I just have to work out what the best balance is.
Yeah. And if you are passionate about something, you will find a balance, right? It's not
Yeah.
that well, I have to give one up to do the other. Whereas traditionally that was the mindset that, you know, not just GPs but doctors in general, like, well, you just need to focus on your career and nothing else. Whereas actually these days, you know, there's so many people doing so many different things and balancing it all really well, at least on the surface anyway. But it seems like you're doing that really well, and it seems like you enjoy it, because you can tell from the videos that you enjoy it. Which is good. There's another GP called Ravina Babu who does a lot of dancing in London, and we interviewed her recently about her dancing, and she was telling us about how the stuff she learns in dancing helps her in her day-to-day GP land, and vice versa as well. So I know it's really good. It's really good what you're doing, and hopefully you'll carry on doing that as well as the minor surgery, as well as the med ed and everything else that you do.
Thank you.
But tell me, okay, before we go, tell us 3 things. Actually, one more question before the final 3 things. That you went into GP, and you talked about thinking about surgery and stuff in the past. What kind of perceptions do you get when you say I'm a GP trainee, from perhaps people that you didn't know you were going to do GP training, or thought that you were going to go into surgery? Or what are the perceptions been like now that you're a GP ST1, both in hospital but also in general?
I think that's a really good question and a really important topic. And I know we're all, you know, focused on how things have improved. Things are so much better, especially for female doctors, and surgery is, you know, a more welcoming world. I probably have to still say that we've got a lot to improve on. I think surgery, the main thing that put me off surgery, I think, was I didn't really find a mentor that really, I mean, I know it's more in our hands as a person looking up to find someone, but I didn't really find someone that I looked up to and said, that's who I want to be, or that's the person that I would like to help me. Whereas in GPs, I looked at so many general practitioners out there. I'm like, wow, they're doing such a fantastic job, and they've got such a fantastic personality, fantastic aura, and that's the kind of person, overall human being I want to be. And I think that's really what made a huge difference into me swaying into doing general practice. More than that, I think when I started, for example, my surgical rotations at my hospital job, and I introduced myself as an SHO, and then obviously they'll know that you're a GP trainee, and there's a little bit, you can see there's a little bit of hesitation. It's like, oh, okay. And then you can see in their head, they're thinking, oh, maybe they're not going to be that great at surgery, practical skills. And then I was like, actually, you know, I've done these courses. I'm quite interested. I am quite enjoyable. I think I'm quite competent at doing practical skills. And I'm willing to learn more than anything. So, yeah. And then after a few weeks, they got to know me, how I worked, and, you know, what my capabilities were. And then they learned to be like, actually, shouldn't judge someone just based on the role that you think. But also this says a lot that actually there are still presumptions about what a GP trainee is like, that they're only there for talking and not doing actually more practical skills. But also this idea that we're slightly less competent, which I completely disagree with.
It's a perception that's obviously still there, as you said. And it's going to be one that's going to be hard to fight, hard to shake off. But it is getting there, and people are, you know, that it is changing a little bit, but it's got a while to go from the sounds of it. And what about perceptions of maybe people in general practice who know that you do lots of other things? Like, have you got any negative comeback about, oh, why are you doing so much, and maybe you should just focus on your training for now? Has that come your way?
Actually, not so far. I think because my supervisor is someone who does more than me, I think she's always been quite encouraging. And, you know, when I was, you know, yesterday I was volunteering, vaccinating, and, you know, this morning when I went in and did my clinic, she was asking me about it. I mean, she obviously knows about it and is involved in signing it off. But I think even if she wasn't, I think she would genuinely be interested in how I was doing. I think if you are able to manage your normal training duties well, show that you are competent enough, or, you know, forget, you're not always going to have the knowledge. I'm learning a lot every day. My knowledge isn't up to scratch. Obviously, I'm just a GPSD1, but actually having that passion to learn and train, it's actually quite commendable if you are doing other things, I think. But I am sure there are people who think, oh, she's probably doing way too much, you know, she should just relax a little bit. But I think also then it's important to recognize that people are different. My ways of relaxing are going to be slightly different to other people. And again, what you put out there is not always the whole stories, but
Yeah,
I
of course.
think it's quite important to remember.
Yeah, and just accepting that people are going to have their thoughts and their
Yeah,
perceptions, and
exactly.
you can spend a whole lot of energy trying to change it, or you just carry on doing what you're doing,
Yeah.
and it sounds like that's what you're doing, which is really,
Yeah.
really good. So we get a lot of people who are torn between, especially international medical graduates, what
Yeah.
should I do general practice?
Yeah.
I was a born surgeon, I was a born medic,
Yeah.
and is this GP thing good for me? So let's just try and finish on three
Mm.
positives of general practice,
Yeah.
GP training, that you can think shine out for people who are thinking, okay, is it me or is it not?
Okay. So I think the first thing will be, it's never ever going to be boring. I know a lot of people say, oh, you just sit in a clinic all day and you don't to the same patients, but actually what you put in is what you get. And I think seeking out, a GP surgery that aligns with your working way, the population group you want to work with, it can be as exciting as you want it to be, even if you just do pure GP, I think. Yeah. And also to remember that we see so much in a day. You can see 10 different specialties, and you do need to have a good knowledge about them, to understand, when am I referring, or what the initial investigations and management is. So the variety is second to none, in my opinion.
That's a good starting point. Two more.
So number two, I'd say, and this is probably, I think, for me, it's a very friendly specialty. I think I've met probably the kindest and just easy to get on with people. I think I've had the least, abrupt responses on the phone when you're trying to refer someone, for example, and you're on call. I've never had that in GPs, touch wood, so far. Not a single person I've met. I mean, obviously they'll maybe find someone one day. But so far, I have not met a person that has, not been welcoming, friendly, approachable. And I think generally people in general practice have to develop that sort of manner to be a good GP, in my opinion. So I think you're always going to be welcomed in general practice. And I think even if you do choose a different specialty, there's a lot of people, I think, who train and then after that they switch over to GP and they come to the good side. I think you realize that actually it's a very friendly and welcoming specialty, and you can always ask for help, I think.
Yeah, 100%. Always ask for help. People are usually pretty happy for you to do that, and they want you to ask more. Go on then, number three.
So number three, again, probably one of the top reasons why I did GP is I think it's very independent. Yes, you're working for the NHS. If you choose to do that, you can work private, and there are other opportunities, obviously. But overall, it's a very independent specialty. I think you've got a lot of autonomy. Yes, with that comes accountability, responsibility, slightly, more responsibility in the way you need to be a bit careful about, how you're managing patients, etc. But I think that comes with the role. But that independence, I don't think you get as much in hospital specialties, in pretty much at all, in my opinion. I think you are always bound by someone else, and even when you work through the training program, there's a lot of hoops and hurdles to pass through. And obviously in general practice you have that, but I think you are a little bit more independent in your learning and your development as a clinician, and how your approach is to being the doctor that you want to be.
Yeah, that's a really, really good point. The autonomy is there, but the responsibility comes with it.
Yes.
And that makes it enjoyable and interesting, because you have to be at the top of your game. Exactly. Because you know that I'm responsible for what I'm doing, and it's me. And it's me. And some people thrive on that, and some people find it a little bit too challenging. But that's amazing. 3 really, really good ideas. And if ever people come to say, why study GP, I was going to point to this video, because it's on a plate, basically, why GP is so good. It's not for everybody. Let's not pretend it's for everybody, but those are 3 top reasons.
Yeah, definitely.
For sure. And hopefully you stay thinking those are 3 things throughout your training and into the next 10, 15 years, because some people have some negative experiences with GP training as well, and being a GP. So that was really, really helpful. Juhee, just tell people, if they don't know you on your other socials, where they're going to find you. Obviously, they're seeing you on IG now, but where else are you? Where can they watch you and see what you're doing?
So on Instagram, as you probably already can see, I'm under Dr Juhee, Dr Juhee. I'm also on Twitter. I do use it sometimes on and off. It's at Juhee Pahuja. Also, all my dance videos are on YouTube, again under Juhee Pahuja. And I do use TikTok. I'm not sure if I'm the world's biggest fan of TikTok at the moment, but my dance videos are also there. But best place to see me is Instagram and Twitter. And as I said, any questions, anything at all, please do reach out. More than happy to answer any questions.
Yeah, please do, and that's really good. And guys, take advantage of this. Not many people are out there happy to help and take questions amongst all the busy stuff that people are obviously doing. So take advantage of that, because you'll get some great insight, I think, into what it's like to be a GP trainee. But thank you so much, Juhee.
No,
hopefully we can help.
Having me.
Hopefully we can help you in October or Jan or May or any of your AKT.
Definitely.
But yeah, it's been super, and I think a lot of value for people. Working tomorrow?
I am actually doing my ITP day, so
fantastic.
medical education. So I've got a few meetings working on the project for medical students, and yeah, so working from home just because of COVID, but otherwise I would be on site.
Fantastic. Brilliant. Thank you so much, Juhee. Have a good day. And guys, thank you for joining. Sorry, I know you guys have been putting some questions out. We haven't seen all of them fly through, but hopefully you got some value out of this, and we'll see you on the next IG Live. Take care, guys.
Thank you. Bye.